Ladies and gentlemen, it's my pleasure to give a talk about the comparison of ESC 2024 hypertension guideline versus ESH, European Society for Hypertension, year 2023 hypertension guidelines. As we all know that in this year's European Society of Cardiology Congress held in London in this autumn, there is a new hypertension guideline initiated by ESC. That name is Guidelines for the Management of Elevated Blood Pressure and Hypertension. This guideline has arose many concern along the hypertension community all over the world, because this is the latest version of European hypertension guidelines, but this is separated, initiated by European Society of Cardiology without the involvement of European Society of Hypertension. We also know that about 1 year before that, European Society of Hypertension guidelines for management of arterial hypertension has been issued in their ESH meeting in Milan. So what is the difference and the similarity about these two hypertension guidelines? We think that many of the colleagues from the hypertension community are very interested. Here I show some facts between these two guidelines. As for the authors and task force members, we can see that in the 23 ESH guidelines there is nearly 60% involved, and in the ESC guidelines only 24 experts involved in these new guidelines. For the volume of the two different guidelines, we can see that the print pages of ESH guidelines nearly 1736 pages, and the ESC guidelines only about 1,000 print pages with a little bit less reference included. When we focus on the final recommendations between these two guidelines, in the ESC new guidelines there is 36 recommendations in total, and in the ESH guidelines it is 47. But there is a similarity between two guidelines, because no matter ESH guidelines or ESC guidelines, they all invited the partner societies, such as in ESH guidelines, International Society of Hypertension and European Renal Association are jointly take part in the or endorse such guidelines. While in the ESC guidelines, we can see that European Society of Endocrinology and European Stroke Organization are also involved. When we focus on similarity and differences between these two guidelines, I here and cited a paper recently published by Guido Grassi and Giuseppe Mancia in Pharmacological Research. They list some similarities between the two guidelines, because we can see that the threshold for the hypertension diagnosis still 140/90 millimeter of mercury, and both guidelines have introduced more intensive blood pressure control strategies, and that the target BP should be less than 130/80 millimeter of mercury. But we can see there are still many differences between these two guidelines, such as the threshold for normal BP are very different between these two guidelines. As for the cardiovascular risk stratification, they also use different system for the stratification for the cardiovascular risk. And when we focus on pharmacological treatment of hypertension, the two guidelines also introduce different strategies, and such as the beta blockers are not listed as first-line pharmacological treatment for hypertension in the 2024 ESC guidelines. So the next slide I will show some details between the two guidelines. One of the biggest changes of the European Society of Cardiology hypertension guidelines is it has introduced a new blood pressure category. That means the elevated blood pressure. When we use office blood pressure measurement, the systolic should be 120 to 139, and diastolic blood pressure is between 70 to 89. This new category are different from the high normal range from the European Society for Hypertension guidelines, as well as the latest Chinese hypertension guidelines, because in the ESH guidelines, the European Society for Hypertension experts still focus the high normal range in 130 to 140, and the diastolic blood pressure only limited between 85 to 89. So these also are different from our Chinese hypertension guidelines. And the ESH guidelines still introduce the isolated systolic hypertension as well as isolated diastolic hypertension, because the latter has been involved many young patients, which is more prevalent in China right now and in the future. The office blood pressure measurement are also both recommended by ESC guidelines and ESH guidelines, but we can see that both guidelines are very focused on the validated devices to use in the clinical settings, and both guidelines give some details on how to make a standard blood pressure measurement in the office setting. But on the other hand, we can see that the out-of-office blood pressure are recommended in both hypertension guidelines. We can see when we focus on 24 hours mean blood pressure, the threshold for diagnosis of hypertension with ABPM was 130/80. It is the same in the ESC guidelines. When we focus on home blood pressure measurement, 135/85 is the threshold, and the same is in the ESC guidelines. But on the other hand, we can see that the home blood pressure measurement or ambulatory blood pressure measurement is recommended in both guidelines, because the office blood pressure measurement may be have misunderstood in some special phenotype, such as the masked hypertension, vertical hypertension, If the resources are available, the both guidelines recommended to use out-of-office blood pressure measurement to confirm the diagnosis of hypertension beyond the office blood pressure measurement. When we focus on the 2024 ESC guidelines, we can see that in the new category introduced in this guidelines, that is elevated blood pressure, when the cardiovascular risk evaluation is high or very high, the confirmed blood pressure measurement with out-of-office blood pressure are recommended as a class 1 recommendation. When we focus on the cardiovascular risk stratification, we can see that the two guidelines use two different systems for cardiovascular risk evaluation. In the ESC guidelines, just like other ESC guidelines, such as in acute coronary syndrome or chronic coronary syndrome, the score 2 or score 2 in old person or score 2 in diabetes are used in the new ESC hypertension and elevated blood pressure guidelines. While in the year 2023 ESH guidelines, the total cardiovascular risk was evaluated, which is decided both on the blood pressure level as well as the other combined risk, cardiovascular risk factors, or with or without target organ damage, or complicated with coronary or cerebral or kidney disease complications. When we focus on the blood pressure target, that the both guidelines are recommended to very intensive blood pressure control. But in the ESH guidelines, the ideal goal is to lower office blood pressure below 130 over 80 millimeters of mercury. But when we return to the 2024 ESC guidelines, we can see that a more aggressive blood pressure target or blood pressure goal were recommended, as we can see that most patients should be reach the goal below 120 millimeters of mercury. Only those who are not tolerated the target BP should still be treated as low as reasonably achievable, preferably below 140. But if the blood pressure between 120 to 129 is not tolerated in clinical or real-world settings. So this special reminder may be in the clinical settings, such as when we treated the very old person, the patients with frailty at any age, or with other complications, the very a little bit more loose blood pressure range can be used in this situation. When we take a look at the pharmacological treatment of hypertension, we can see that in the 23 ESH guidelines, RAS inhibitors, calcium channel blockers, diuretics, as well as beta blockers are also listed as a first-line pharmacological treatment for hypertension. While in the latest ESC guidelines, we can see that beta blockers are only recommended to be combined with any other major blood pressure lowering medications when there is combining indications for beta blockers, such as coronary heart disease, angina, paroxysmal and post-myocardial infarction, and heart failure with reduced ejection fraction, or those who with sympathetic nervous system activation and need to a more intensive heart rate control, such as in the young people with hypertension. Finally, when we focus on the renal denervation, we can see that when we take a look at the 23 ESH guidelines, they recommended that renal denervation should only be performed in experienced and specialized centers to guarantee appropriate selection of eligible patients and completeness of the procedure. This is very similar to the Chinese hypertension guidelines recommendation. And as the same, we can see the 24 ESC guidelines. They also recommended to perform such a procedure in the center with medium to high volume. That means there is enough patients, enough experience in the hypertension centers who have the establishment or situation to further perform renal denervation. But shared decision-making seizure are both recommended in ESC guidelines and European Society of Hypertension guidelines. This may be the patient-centered care in many clinical decision-making, not only focus on hypertension, but also such as coronary heart disease or heart failure. I think that's all for my presentation on the comparison of these two hypertension guidelines. Thank you.